Final review. The use of X-rays to create a medical image on patients is referred to as radiography. Particular care must be taken when using radiation for medical imaging. This is a result of radiation's ability to create ionization in human tissue and possible biochemical changes. The Greek physician Hippocrates is regarded as a father of Western medicine. His beliefs include closely monitoring patients and diet and exercise, allowing nature to work. He does not believe in witchcraft. An X-ray procedure used to diagnose a myocardial infarction is called coronary arteriography. An imaging modality that uses no ionizing radiation is MRI. A physician who specializes in the interpretation of medical images is a radiologist. PACS, PACS, stands for Picture Archiving and Communication System. Internal committees found within the hospital include the Safety Committee, Pharmacy and Therapeutics or P&T Committee, Infection Control Committee, and the Radiation Safety Committee. The MQSA is the Mammography Quality Standard Act. RA stands for Radiologist Assistant. The radiography practice standards are developed and maintained by the American Society of Radiologic Technologists, or ASRT, and the Joint Review Committee on Education in Radiologic Technology, or JCERT. The process whereby an organization seeks recognition from its peer groups through demonstrated compliance with developed standards is termed accreditation. Accredited programs in radiologic technology are recognized by the Joint Review Committee on Education in Radiologic Technology. Programs seeking this recognition necessarily must comply with the JRCERT standards and essentials. The hospital's CEO or president reports to the board of directors. A formal document that outlines the departmental structure of a hospital showing lines of authority, reporting structures, and the interrelationships of department is an organizational chart. All of the physicians practicing medicine within a hospital make up the medical staff. Forms of energy include heat, sound, magnetic, electrical, electromagnetic, and nuclear energy. Ionization is a process wherein a neutral atom gains or loses an electron. The medical imaging specialty of nuclear medicine uses radiopharmaceuticals and gamma radiation in the production of medical images for patient diagnosis. Throughout the history of medicine, remarkable achievements have been recorded. These events have led to our current understanding of the human organism and disease. As this research continues, much of it will most likely focus on human genes and genetic engineering. The study of diseases of muscles and bones is termed orthopedics. Eligibility to sit for the RADT exam. Radiography requires completion of an RADT-recognized accredited program in radiography. The organization that is principally responsible for the general welfare of the profession of radiologic technology, through its efforts in continuing education, practice standards, and socio-economics is the ASRT. Special protection should be taken to prevent excessive exposure to ionizing radiation. The health occupation that deals with the management of patient medical records and medical coding are the health information services. The education of radiographers involves the commitment and dedication of many people. All of the following may be involved with and responsible for your education as a radiographer: clinical coordinator, instructor, didactic faculty member, and program director. American Healthcare Radiology Administrators publish the journal Radiology Management, offers a certification examination for radiology administrator, and plays a key role with the manpower needs of the medical imaging profession. An example of out of control language is: I can't believe I have all of these exams in the same week. It's so unfair. A firm reference point for determining the appropriate behavior for technologist would be referencing the ASRT practice standard and the American Registry of Radiologic Technologists, or ARRT Code of Ethics. Student learning within a classroom is known as didactic learning. An example of a stress buffer is exercising with a friend for 45 minutes the day before a test. The three phases of correct learning are observation, assistance, and performance. As a student radiographer, you have received a requisition to perform a procedure that requires indirect supervision. In completing the exam, you mistakenly mislabel the image with regard to left and right sides of the patients. Department policy requires a repeat in images. In doing so, you must be aware that a qualified practitioner must review your repeat procedures and supervise your work. A female radiography student is considered pregnant when she voluntarily declares it in writing to the program officials. As a RAD student, you will be expected to have 37 hours in clinical competency. A department supervisor asked students to skip a meeting due to staff shortage. This is viewed as a violation of JRCERT standards. The Sacred 7 in medical history taking refers to 7 key attributes used to evaluate a patient's symptoms and illness. They are localization, quality, quantity, timing, setting, influencing factors, and associated manifestations. An example of subjective data is an opinion, such as a patient relating that they feel a crushing pain in chest. Objective data consists of facts. Vital signs are an example. Chief complaint is a concise statement describing symptoms or problems a patient is experiencing. Leading questions predict the answer, and lead to a conclusion. These questions are logical when a patient tells you that their back is hurting. Where does it hurt? How long has it hurt? Has this happened before? Have you recently lifted anything that is heavy? A radiographer should never remove bandages during radiographic exams. If a patient's bandages became soaked in blood, wait for a nurse to change them but apply pressure until the nurse gets there. Human diversity is also called cultural diversity. Characteristics of human diversity include age, disability, ethnicity, religion, gender, and race. Values that are prescribed by mainstream culture in the United States are independence, equality, directness, activity, and hard work. Cultural competency is gaining knowledge of other cultures. Globalization is the crossing of national borders to receive healthcare, work, school, live, or even to just visit. Bias is prejudice in favor of or against something. 5 significant human diversity traits within a society are age, race, gender, abilities, and ethnicity. The American with Disabilities Act prohibits discrimination against disabled individuals. Royce Osborne Minority Student Scholarship reflects a commitment to cultural diversity in an integral part of the medical imaging professions. Descending levels of Maslow's hierarchy are 1. Self-actualization, 2. Esteem, 3. Love belonging, 4. Safety, 5. Physiological. An inpatient resides in a hospital. An outpatient does not occupy a hospital bed. Different uses of touch that are best for a radiographer involve only the fingertips for palpation and for light pressure. An emotion common to many patients who enter the hospital is fear. Negative nonverbal communication techniques include rolling one's eyes, aggressive touching, and taking deep breaths. 5 steps of the grieving process are denial, anger, bargaining, depression, and acceptance. A 7-step version includes 1. Shock. This initial stage is characterized by disbelief and numbness, as the reality of the loss is difficult to grasp. 2. Denial. A way to cope with the pain, denial involves refusing to believe that the loss has occurred. 3. Anger. As the reality of the loss becomes clearer, anger can surface, directed at the loss, oneself, or others. 4. Bargaining. A desire to undo the loss. Bargaining involves making deals or promises to bring the situation back to how it was. 5. Depression. The emotional weight of the loss can lead to feelings of sadness, hopelessness, and despair. 6. Testing. This stage involves trying to find ways to make sense of the loss and find a way forward. 7. Acceptance. While not necessarily feeling okay, acceptance signifies a move toward integrating the loss into one's life. An advance directive for healthcare is a legal document that allows you to outline your medical treatment preferences and designate someone to make healthcare decisions on your behalf if you become unable to communicate your wishes. These documents ensure your healthcare wishes are respected, even if you can't speak for yourself. PSP technology incorporates photostimulable storage phosphor. PSPs are materials that store energy absorbed from X-rays or other ionizing radiation and then release it as light when stimulated by a specific wavelength of light, typically a laser. This process, called photostimulated luminescence, or PSL, is used in applications like computed radiography, CR, to create digital images. Sources of ionizing radiation can be natural, internal, or man-made. Direct action of ionizing radiation occurs when a particle hits a DNA molecule head-on. Indirect action occurs when a particle hits a water or other molecule to produce free radicals. Acute radiation syndrome, ARS, progresses through 4 distinct stages: prodromal, latent, manifest illness, and either recovery or death. The prodromal stage involves initial symptoms like nausea, vomiting, and diarrhea. The latent stage is a period of apparent recovery, where symptoms may lessen or disappear. In the manifest illness stage, the specific syndrome associated with the radiation exposure manifests, with symptoms lasting from hours to several months. Finally, the condition progresses to either recovery or death, with recovery times ranging from weeks to years. There are 5 interactions between X-rays and matter. Coherent scattering. Rayleigh scattering X-rays interact with the atoms in matter, causing them to temporarily vibrate and then emit photons with the same energy and direction as the original X-ray. This process doesn't change the energy or direction of the X-rays, but it can affect the image quality. Compton scattering. X-ray photons interact with loosely bound electrons in the matter, transferring some of their energy and momentum to the electrons. This causes the X-ray to be scattered at a different angle and with lower energy. This interaction is a major contributor to scattered radiation in X-ray images. Photoelectric effect. X-ray photons interact with inner shell electrons in the matter, ejecting them from the atom. The atom then becomes ionized, and the ejected electron absorbs all the X-ray's energy. This effect is significant in creating contrast in X-ray images. Pair production. When X-ray photons have a high enough energy, typically above 1.022 MeV, they can be converted into an electron and a positron within the nucleus of an atom. These particles then move away from the nucleus, carrying some of the X-ray's energy. Photodisintegration. At very high X-ray energies, above 10 MeV, the X-ray photons can interact with the nucleus of an atom, causing it to eject a nucleon, a proton or neutron. This interaction is less common in medical X-ray imaging. Here is the difference between somatic effects and genetic effects. Somatic effects consist of biological damage to the exposed individual caused by ionizing radiation. Genetic effects damage sperm or the ovum as they combine with another reproductive cell, affecting future generations. The 3 key principles of radiation protection are time, distance, and shielding. Radiation monitoring devices include a personal dosimeter and a Geiger counter. In positive beam limitation, a collimator automatically adjusts the size of radiation field to match the size of the imaging devices. Lyme disease is a condition caused by bacteria carried by deer ticks. The tick bite may cause fever, fatigue, and other associated symptoms. Transmission of an infection is carried by a vector, the vector in this case being a deer tick. Streptococci and bacilli are classified as bacteria. The process of establishment and growth of a microorganism on or in a host is referred to as an infection. Any microorganism that causes disease is pathogenic. A disease that is spread by kissing is being transmitted by direct contact. When a disease is spread by an insect depositing the pathogen on or in a human, it is transmitted by a vector methodology. Chemical substances capable of killing pathologic microbes are bactericidal. At the conclusion of an interventional radiographic exam, the exam room is cleaned and major components are wiped. By doing this, the radiographer is practicing medical asepsis. A few days after a stereotactic breast biopsy performed by a radiologist in a great imaging center, the patient returns to her physician with infected incision site. This is an example of an iatrogenic infection. An iatrogenic infection is an infection that a patient acquires as a result of medical treatment or care. These infections are not present in the patient before the medical intervention and are, therefore, a direct consequence of the treatment itself. A pathogen that requires contact precaution is MRSA, methicillin-resistant Staphylococcus aureus. MRSA infection is caused by a type of staph bacteria that's become resistant to many of the antibiotics used to treat ordinary staph infections. The inflatable balloon portion of the Foley catheter is typically filled with sterile water. A Foley catheter is a thin, flexible tube used to drain urine from the bladder and is also known as an indwelling urinary catheter. It's inserted through the urethra and into the bladder, where a small balloon keeps it in place. The urine then drains through the catheter into a collection bag. The expiration date should be examined when a sterile package is first used. If the sterility of an object is unknown, throw it away. When handling a patient with a Foley catheter in place, remember to avoid kinks, and to keep the drainage bag lower than bladder. When a Foley catheter is inserted into a patient for an expected period of 4 to 6 weeks, polyvinyl chloride catheter is used. NG tubes are inserted with the patient placed in a high Fowler's position. A nasogastric tube, NG tube, is a thin, flexible tube inserted through the nose and into the stomach. It's primarily used for feeding, medication administration, or to drain the stomach. In high Fowler's position, a patient is seated upright with their upper body elevated at an angle between 60 and 90 degrees, while their legs may be straight or bent. This position is commonly used to facilitate breathing, eating, and swallowing. To facilitate removal of a nasogastric tube, the patient is asked to take a deep breath. The most common type of nasogastric tube used for the stomach decompression is the single-lumen Levin tube. A Levin tube, a single-lumen NG tube, is particularly designed for gastric decompression and aspiration. When transporting a patient with a NG tube to medical imaging, confirm allowable time for suction interruption and make sure that BTHE NG tube is secured. After bedpan use, hygiene of the female patient's perineum is important. Proper cleansing of this region requires using gloves and tissues to wipe from the direction of mons pubis to the anus, and not vice versa. Medical asepsis, also known as clean technique, aims to reduce the number of microorganisms and prevent their spread. Surgical asepsis, or sterile technique, focuses on completely eliminating microorganisms and creating an environment free from them. A nosocomial infection, also known as a hospital-acquired infection or healthcare-associated infection, HAI, is an infection acquired in a hospital or other healthcare facility. These infections are not present or incubating at the time of admission and develop during the course of receiving healthcare. An iatrogenic infection is an infection acquired as a result of medical treatment or care. These infections can arise from medical errors, negligence, hospital-associated infections, HAs, or other factors during treatment. REM stands for Röntgen Equivalent Man. It is a unit of measurement used in radiology to quantify the biological effects of ionizing radiation on the human body. In radiology, the Röntgen, R, is a unit of measurement for the exposure of ionizing radiation, specifically X-rays and gamma rays, in air. It quantifies the electric charge freed by such radiation in a defined volume of air divided by the mass of that air. 1 Röntgen is equal to 1000 milliröntgens, MRs. While still used in some older systems, the Röntgen is largely replaced by the SI unit of exposure, Coulomb per kilogram, or C/kg. The SI unit for exposure to ionizing radiation in air is Coulomb per kilogram, C/kg, and curiously, unlike other SI radiation units, a specific name has not been adopted for this unit. This unit officially replaced the old unit, the Röntgen, in 1975, with an official transition period lasting at least 10 years. In radiology, a gray refers to the SI unit of absorbed dose, denoted by GY. It measures the amount of energy deposited by ionizing radiation in a material, specifically 1 joule of energy per kilogram of matter. The joule, J, is the fundamental unit of energy in the metric international system of units, SI*. It is the largest unit of energy encountered in radiology. 1 joule is equivalent to 1 watt-second. A 100-watt light bulb dissipates 100 J of energy per second. In radiology, a sievert, SV, is the SI unit for measuring the biological effect of ionizing radiation, specifically the equivalent dose and effective dose. It quantifies how much radiation is absorbed by the body and takes into account the type of radiation and its impact on different tissues. Equivalent dose refers to the amount of radiation absorbed by a tissue or organ, taking into account the type of radiation, X-rays, or neutrons for example, and its relative effectiveness in causing biological damage. Effective dose builds upon the equivalent dose by incorporating tissue weighting factors, which reflect the varying sensitivities of different organs and tissues to radiation. It gives a more realistic estimate of the overall risk associated with radiation exposure. 1 sievert is equal to 100 REMs, a unit commonly used in the US. It's also equivalent to 1 joule of energy absorbed per kilogram of tissue. Sieverts, and smaller units like millisieverts, MSV, are used to measure the radiation dose received by patients during medical imaging procedures like X-rays, CT scans, and nuclear medicine procedures. For example, a chest CT scan typically delivers a dose of around 7 millisieverts. Understanding and measuring radiation exposure in sieverts is crucial for implementing appropriate radiation protection measures in hospitals, clinics, and other facilities where ionizing radiation is used. Density refers to the darkness or blackness of an image, influenced by MAS, the quantity of X-ray photons. Contrast refers to the lightness or whiteness of an image, influenced by the kilovolt peak, the quality of penetrating X-ray photons. Radiolucent matter easily transmits X-rays. Air is a good example. These targets appear dark on an image. Radiopaque matter does not easily transmit X-rays. Bones and metals are good examples. These targets appear white on an image. Diagnostic efficiency refers to the accuracy of image.